Therapists and mental health care providers are seeing more patients than ever before in this pandemic. Alexa Liacco spoke with a mental health hotline worker about how they're helping people through some of their darkest moments.
Crisis line, this is Nicole. How can I help?
Her voice may be calm.
Let me get some information and we can see what we can do to help you out, okay?
But her mind is racing for answers.
Are you feeling safe right now?
Each question is her chance to help.
Are you having any thoughts of wanting to hurt yourself?
A chance to heal.
So you said you wanted to talk to someone. What's going on?
It's no easy job, but one Nicole knew she wanted.
I found a big passion with providing care to people who didn't know where to turn.
She started answering calls at the Solari Mental Health Crisis Hotline just as COVID-19 swept the nation.
That was really scary. I mean, they were calling for answers. And how am I going to tell you where to find toilet paper when I don't know where to find toilet paper? So, we don't necessarily have those answers, but we can be there to provide, that emotional support.
The Solari Crisis Center in Phoenix gets 25,000 calls every month. During the pandemic,
Crisis line, this is Nicole. How can I help?
More first-time callers have asked for help than ever before.
Anxiety and depression have increased pretty dramatically, and we have found out that most of our callers are unfortunately on the more acute side of things, needing more immediate kinds of supports.
This is happening across the country. Before the pandemic, 1 in 10 adults reported symptoms of anxiety or depression. Now, nearly 2 years into this crisis, about 4 in 10 U.S. adults report symptoms of anxiety and depression.
Is he inpatient or is he outpatient?
And some people are at higher risk because of the pandemic, including minority groups like Native Americans and African Americans who are hit harder by the virus, children and young people who have had school and social time disrupted, and healthcare workers.
I will transfer you over there.
One call from a young girl living on a Native American reservation sticks with Nicole to this day.
She had a plan and means and intent to complete suicide. She was 8. She had never called us before. I would be surprised if she dialed any phone number all by herself before. She had broken a mirror, and her plan was to cut her wrists and die that way.
But in time, Nicole made a breakthrough.
We were able to build that trust to get Mom on the line, which was our saving grace. That was definitely, I think, one of the youngest, more acute callers.
Despite the pain she sees every day, this first responder constantly reminds herself and her callers of one thing.
Although these feelings are big and heavy and feel completely out of control, this isn't what forever's going to look like.
She just hopes this time of uncertainty will encourage those struggling to reach for a lifeline waiting on the line.
Hope is there and hope is real, and that's really important.
For The Race, I'm Alexa Liacco.
More to come on The Race. Stick with us.